All right, let's talk about one of the most intense, high-stakes situations you could ever face as a nurse: mass casualty triage. We're going to break this down so you can nail it on the NCLEX and, more importantly, know how to make the right call when it really, really counts. Let's get right into it.
So I want you to picture this. There's been a massive accident. You're the first medical person on scene. You see 30 victims, people are screaming, and you've got basically nothing but the supplies in your kit. Your nursing brain is hardwired to help the person right in front of you, right? Well, in a mass casualty incident, you have to fight that instinct. The game totally changes. It's not about who's in front of you. It's about who you can save first to save the most people.
And that, right there, is the core of disaster triage. It's a rapid-fire sorting process. You're not treating. You're just assessing and deciding who needs care now, who can wait, and who can't be saved. The goal is to do the greatest good for the greatest number of people. It's a huge mental shift from our usual one-on-one patient care.
This right here, this is the mantra. You need to burn this into your brain. For the NCLEX, this is everything. During that initial triage, you are not starting IVs. You are not giving pain meds. You are absolutely not doing CPR. Your one and only job is to sort and tag. That's it. So, how do we bring some order to all that chaos? Well, we use a universal system that everyone understands: the 4-color triage tags. This is like a language that lets every rescuer who shows up know a patient's priority with just one look. Let's break down exactly what each color means.
Okay, first up, red. These are your top priority people. We're talking critical, life-threatening injuries, but, and this is the key, they have a good chance of making it if they get help immediately. Think major bleeding, airway problems, shock. These are the first patients out of there.
Next, we have yellow. Now, these patients are seriously hurt, no doubt about it, but their condition is stable enough that they can wait a bit. Think of someone with a big open fracture, but their pulse is strong and they're not bleeding out. They definitely need to go to the hospital, but they can hold on.
Then we've got green. We call these the walkie-talkies because, well, they can usually walk. Their injuries are minor: cuts, scrapes, maybe a sprained ankle. In a real MCI, you might actually just point them to a safe area and have them wait there, which frees you up to deal with the reds and yellows.
And last, and this is the hardest one, is black. These are patients with injuries so severe, like a devastating head injury, that they're not expected to survive, or they've already passed away. The brutal reality here is that any resources used on them would be taken away from someone with a real chance of survival. You have to tag them and move on.
Now that line between a red tag and a yellow tag, it can get a little blurry, and you better believe the NCLEX loves to live in that gray area. So how do you make that call? How do you decide between someone who needs help right now versus someone who needs help soon? It all comes down to their ABCs: airway, breathing, and circulation.
Let's make this super clear with some examples. Okay, scenario 1, a patient with an amputation that's spurting bright red blood. That's a massive circulation problem. That's a red tag, no question. But a patient with a nasty open fracture with some bleeding that's controlled and a good pulse, they're yellow. Scenario 2, someone with a chest wound who's gasping for air. That's a breathing emergency, they're red. But another patient with broken ribs who's in pain but breathing okay, they're yellow. See the difference? And finally, if someone is showing clear signs of shock, a fast, weak pulse, clammy skin, that's a circulation crisis. They get a red tag. But someone with a major cut but totally stable vitals, they're yellow. It's all about those immediate threats to life.
Okay, so you've done it. You've moved through this incredibly chaotic scene. You've assessed everyone, and every patient has a tag. The sorting phase is over. But obviously, the work is just getting started. What happens after the tags are on? This is where we shift gears from sorting to a real systematic assessment. Once the tagged patients are moved to a treatment area, the approach changes. For the red and yellow tagged patients, we now move into what's called the primary and secondary surveys.
The primary survey is your first chance to actually treat someone, and it's all about finding and fixing the immediate killers using the good old ABCDs. We check the airway, make sure breathing is happening, assess circulation and stop any big bleeds, check for disability, their neurostatus, and finally exposure, which means getting their clothes off to see what else is going on while also keeping them warm.
So, you've gone through the primary survey. You've handled the immediate life threats. The airway is clear, the bleeding is stopped, the patient is stabilized. For now. What's the next step?
And this is where the secondary survey comes in. Think of this as the detailed investigation. It's a complete, systematic head-to-toe exam. You're now looking for all the other injuries that weren't an immediate threat to their life, but absolutely need to be found and treated. Things like other fractures, deep cuts, or internal injuries. So let's be super clear about who does what. The initial rapid triage on scene, that's done by the very first responders to get there. Their job is just to sort everybody. The detailed primary and secondary surveys, that happens later in a designated treatment area. And it's performed by the treatment teams who are focusing on those red and yellow patients you prioritized.
All right, let's wrap this up by boiling it all down to the absolute non-negotiable rules you have to know for the NCLEX. If you only remember one part of this, make it this next slide. This is pure exam gold.
Okay, rule number 1, triage is assessment and sorting only. You are not treating. Rule number 2, in a mass casualty triage situation, you do not perform CPR. It takes up too much time and resources for one person when you could be saving several others. And that leads us to rule number 3, the toughest one. If you find a victim who isn't breathing, you get one chance. You manually open their airway. If they still don't breathe, you tag them black and you move on. It's harsh, but it's the rule that saves the most lives.
Triage is all about making impossible choices in an impossible situation. It's about staying calm, thinking critically, and focusing on the big picture, the greatest good for the greatest number. By really understanding these rules, you're not just getting ready for an exam, you're getting ready to be a leader when people need one most.